Dr. Lee, talk to us about root canals. Again, it's one of those feared topics, and yet last time I went to a root canal as a guy, I was a general doctor like you who did the root canal. All it was is that I couldn't talk to him because I had my mouth wide open, and rather than that, I was just bored while he was doing it, and then it was all finished. Tell us a little bit about root canals. Who needs it? Why needs it? What's really happening in a root canal?
Well, with the root canal, when the nerve gets infected, either because of trauma, the tooth got a blow to it, or you have a lot of decay that goes into the nerve area, the nerve is going to start to die, get infected, and start to cause pain. Or in some people, it might not even cause pain. Everyone's different. Pain is never a good indicator for getting any dental treatment done. We just want to make sure that, we see the signs there. Yeah.
It's nevertheless pretty much the most common indicator why we're going to a dentist.
Yeah. There's people, it's kind of like cancer, it's a terrible thing. There's some people who might not go see the doctor until they're in terminal stage cancer because they've never had pain. That's kind of an extreme example. And, I've had friends and loved ones who've passed away from cancer because they found it too late, because they just didn't have the symptoms there. So just like with anything, we want to make sure that, regular checkups are done so we can see whether or not your teeth are healthy. We basically clean out the diseased nerve tissue and we fill it with the inert rubber-like material. And then we get a crown on top of the tooth after because it's going to be weakened. The funny thing about a root canal, I get a lot of patients that come in over the years. The thought of a root canal is just dreadful. They've heard of people or they've experienced themselves having a terrible root canal where they've had pain for the whole, let's say 1, 2, 3 hours that they've been getting it done. And it's always surprising to them when we're done with a root canal that's all it was. Like you said, they're just kind of bored. Some people fall asleep and start snoring away in the chair. I'm not in the business to, hurt people. If a procedure can't be done comfortably, we'll find some way of getting it done for them comfortably because otherwise that's torture. I'm not going to do something to somebody that I won't want to do for myself. So our patients that get the root canals done, like you said, they're bored, they're comfortable, it's just a longer procedure than getting like a filling done or something. So
what's the difference that sometimes people get a root canal done in one visit and sometimes apparently not at all? Is that just a preference of the dentist, or are there sometimes some clinical reasons why that cannot happen?
If a root canal, root canals, we always like to do them in one visit. Studies have shown that success in a root canal doesn't matter if you do it in 1 or 2 visits. Now, if we do it in 2 visits, the only reason we might do that is there's a lot of pus coming out of the tooth. We want to get that infection under control before we permanently fill it up because we don't want to trap in a lot of infection. So if you have a lot of pus coming out from the tooth, then, we'll put you on antibiotics, have you come back to finish the root canal afterwards.
And what's the story about a root canal apparently needs a crown, and again, yet some people didn't have a crown on the root canal after it was done for a long time, and it didn't fall apart. Can you shed some light on that thing?
Yeah, it depends on the quality of the tooth. In general, when you clean out the nerve tissue, you're also cleaning out the blood supply of the tooth. So the nutrients are going to stop coming to the tooth. It becomes a dead tooth and it's going to start to dry out over time. Now, some people, the quality of their teeth, it's very hard. And their diet maybe doesn't allow the tooth to break down much, or they don't have grinding habits that weaken the tooth, so those people, they might not get a crown and the tooth might be okay for years and years until one day it decides to split or break. Some people have pre-existing large fillings and decay and their teeth are already weak, so they need to get a crown on. Right, some people, if it's a front tooth and we just made a very small hole and that's all it was, and the tooth isn't discolored, we might just put a filling in it and just leave it alone and be done with it too. So it really depends on the tooth and the patient. There's no cookie cutter answer for saying everything needs to be crowned, but a back molar or back tooth should definitely be crowned because it does get a lot of chewing force on there. And if it hasn't broken, the patient's fortunate. But we see a lot of patients come in with split teeth. A large part of the tooth is broken off, and now we need to do surgery on top of just getting a crown on there because the tooth broke down too far below the gums. There's a lot of other things that happen. So it's better to be safe than sorry.
Got it. So because you're drilling a hole in it, so you're basically instead of a big stick, you're making a pipe because the hole is there. So it depends on how big that hole was for you to do the root canal, how small the tooth was, and on how fragile the tooth was in the first place. It might need a crown right away. All of them, not all of them, but in many cases, many of them need it when it's in a back tooth. However, sometimes a patient might get away with many, many years of usage. But if it does break, it could break on a level below the bone where you don't want it to break, where you now need surgery, kind of like for a wisdom tooth kind of type of surgery, and that in itself isn't so comfortable.
Yeah. I mean, we want to prevent these problems, and hopefully, we can educate the patient properly and give them the information so they understand the ramifications for not getting certain treatment done.
Yeah. All right. Wonderful. So technology has definitely improved with root canals. It looks like, right? It's not anymore. And versus a wisdom tooth, a person with a root canal, he's right back to work. Yes or no?
Yeah. We call our patients every night after they've had their root canals done. And I mean, it's rare to get a patient that says they're in utter pain. Most of them say, yeah, they're fine. And that's it. They move on with their lives.
Sure.
So, yeah.
Good. Thank you very much. Very informative again.
Thank you.
Bye-bye.
Bye.